Hey there, friends. Welcome to episode 427 of Better Than Before Breast Cancer. I'm your host, Laura Lummer, and we've got some really great stuff to dig into today. As a person who has been managing cancer in my life for 14 years now, a little over 14 years, and metastatic disease coming up on 5 years. Next month will be 5 years since my stage 4 diagnosis, and coaching women for 8 years now. There's something that is really frustrating, and that is the fact that there's no cure, right? There's no cure. There's no one, not in standard of care, not in the naturopathic world. There's no one anywhere who can just say to you, here's the thing, take this and you'll be fine, right? It's not like a Z pack. I'm going and have an infection of some kind. Here, take this, you'll be good in 5 days, right? We don't have that. And cancer is really complex, and every individual body is really complex. So there's so much that goes into it, and different things work for different people. So this is why I think there's so much confusion and the fear because of the confusion after a diagnosis, or when you're trying to hopefully prevent any kind of recurrence. I think that's just a big part of this journey, and it can cause a lot of suffering. One of the things that really stands out to me, something that I'm so grateful for, that I believe brings clarity to the table, is when I started learning and following the metabolic approach, and I started learning about lab interpretations from a metabolic health perspective, from a terrain point of view. When I started learning and studying and getting trained in nutrition genomics and the interpretation of nutrition genomic reports and what that meant, I found these things to be so fascinating because it landed with me in such a way that said, oh my gosh, this is the language of the body. If we follow this, if we look at our nutrition genomics, if we look at our labs, then it clears up a lot of confusion. Not maybe everything, but it clears up a lot of confusion because it helps us understand exactly what our body needs. So if somebody is saying, oh, here's this vegan plan, and here's this paleo plan, and here's this carnivore plan, right? And everybody's got an idea. And isn't that one person is right and one person is wrong? Because lots of these different approaches have worked for someone, which is why someone got really excited about them and then wanted to share them with the world. But what it comes down to is that not one approach works for everybody. So even the metabolic approach is exactly that. The metabolic approach is what is your metabolism? What does your body need? How does your body work? And then test, assess, address, test again, because the body's always shifting. Everything's always shifting. So I bring this up because I want to talk with you about something that's really important today, and it really does come back to bio-individuality. It comes back to understanding the language of your body. So one of the things that I think everyone is aware of when it comes to supporting our body's ability to heal and be in an optimized state of health is to manage our glucose and insulin, manage our blood sugar, manage our insulin. Now, when we say that, a lot of people think about diabetes. We go straight to diabetes. And I don't know that we really have grasped that understanding, like the general public, I say that really grasped how important this is from a lens of supporting your wellness and reducing risk of recurrence, or supporting better outcomes if you're living with disease when it comes to cancer. So I want to share with you something very interesting that started to stand out to me. So I would do the nutrition genomic reports for my clients, and it was so valuable. It is so valuable, and they got so much out of it. People would start to ask me, can you do this for my family members? And then, of course, friends and family of mine wanted to have them done, which I love to do. But something started to stick out to me, and I started to see with my clients who already had a breast cancer diagnosis, there were some really fascinating commonalities in what I would see in their nutrition genomic reports. And I looked at those and compared them to some of the other clients I had who had not had any diagnosis of cancer. And what I started to see was a really interesting pattern with genetics that influence the way people's bodies handle glucose and insulin, but also the way that their brain works when it comes to the foods that contribute to glucose and insulin dysregulation. So I decided to do a little tiny study of my own. I pulled 20 reports from clients I knew to have had a breast cancer diagnosis. And I wanted to compare them all across the board. And 20 was as much as my attention span could handle. So this definitely is not some randomized clinical trial, but it's just me sharing with you some of the things that I saw. So out of 20 nutrition genomic reports for women who have had breast cancer, I found that more than 90% of these women had genetic patterns that made it harder for their bodies or predisposed them, right? Because just because it's your genetics doesn't mean you're experiencing it. But it's a fascinating thing to see that these genetics were very common, these genetic SNPs, these single nucleotide polymorphism, these variants in their genes, which would predispose them to having more of a struggle with blood sugar and insulin regulation. But in addition to that, a large percentage of them also carried these SNPs, these genetic variants that would predispose them to impulsive behaviors. Yeah, we're going to get into this because this is your brain, right? Your brain is just an organ, and different genetic SNPs can have an influence on how that organ works, which we'll talk about a little more here shortly. But what I started to notice as I looked at those patterns, I thought, well, this is really interesting. Because the combination of having certain genetic variants that may cause your brain to seek rewards, to be impulsive, and to even lean towards addictive behaviors. Now, addictive tendencies, let's be careful. When I'm saying addictive, it doesn't necessarily mean drugs, because we don't always have to be addicted to drugs or alcohol, even though, that's, I think, commonly what we think about when we say addiction. Food, any kind of thing that we do to such an extent that it feels out of control for us, it's not serving us, it's not serving our wellness, right? An addictive behavior, like we feel compelled to do this, even if we're telling ourselves, I really don't want to do this as much or at all, right? So that's more of the addictive tendencies. So when I looked at this combination, it made me really think about something that I hear a lot, and it starts to make a lot of sense. And then what I hear is, I am completely addicted to sugar. Sugar is calling my name. I can't stop myself. I have had many clients say to me, listen, before we even start talking, don't ask me to give up pasta or croissants. It's not happening, right? They're very addicted to certain kinds of foods. And there's no judgment in that. I'm just saying this is what I see a lot. And I understand it as well. So what I realize is that once you understand how your brain and body work, how they're wired, you can also learn how to shift those signals. So there's a big difference between this is how I'm wired and this is how I want to behave. These are the behaviors I want to follow. These are the behaviors that just come up automatically from that organ in my skull, right? That is wired a certain way. So I'm going to share with you later in the show here a framework that I'll call the 5 S's. And what these are 5 powerful ways that I believe help you to calm cravings, to stabilize your blood sugar, and to just support the optimal wellness of your terrain. So before we go too far into this, I wanted to say that sugar does not only mean candy bars. It doesn't mean adding spoonfuls of sugar to your coffee. Sugar is any kind of refined carbohydrate. So the pastas, white bread, white rice, crackers, breakfast cereals, these foods break down very quickly into glucose, and they can cause a sharp spike in your blood sugar. And because sugar is added to so many packaged foods under so many different names, many people don't realize they're eating far more sugar than they think they are, right? Corn syrups and all kinds of dextrins that are added to different things. So even if you think, well, I don't really eat sweets, or someone who doesn't really eat sweets, it's really important to know that sugar can be very sneaky and can show up in your diet in a lot of ways. So, also, what's interesting, let's go back to the idea that your brain is just an organ. One of the things I love to talk with my clients about when we're doing nutrition genomics is when we look at these genes that influence the way their brain works, I like to show them, look at this. This is an organ and it's wired a certain way, but certain behaviors, nutrition, lifestyle practices can change the way that that organ works, can rewire it in such a way that it benefits you. And it's important to understand that this organ inside your head isn't you, right? Like we look at ourselves and judge ourselves a lot of times by thoughts that we have or impulses that we have. And if we can do a little bit of a separation here and say, well, hold on, is that me? That's my brain that's offering this to me. But if I'm able to observe it, if I have a level of consciousness that's here that's saying, oh, I see my brain is offering this impulsive thought, well, then there's a little bit of a separation there, right? And then we can make a choice that can help the brain to develop into a different way. So we don't judge ourselves based on what our pancreas does or what our liver does. Like we don't attach that to our self-worth. But a lot of times we attach our brain to our self-worth, and we attach our seeming inability to not give in to cravings, do not give in to urges as a part of our worthiness. And it's really, really not the same thing. Okay. So some people, they have a genetic makeup that their brain doesn't effectively recycle things like dopamine. Dopamine is that feel-good chemical, right? I'm sure you've heard about it. And so if their genetic makeup doesn't recycle dopamine very efficiently, and what that might mean, or what it might look like in real life, is that when they eat something sweet or starchy, the brain will light up with pleasure, but the effect won't last very long. So the brain wants more. And this can set up a cycle of craving and consumption that really feels like addiction, feels really strong. So there was a study that was published in Neuroscience and Biobehavioral Reviews. And that study found that sugar activates the brain's reward system in ways that closely mirror addictive drugs. The authors of that study said that sugar activates neural pathways in ways similar to drugs of abuse, which may explain addictive like eating behaviors. And trust me, I am very familiar with this because I have a family of people who have a tendency to have addictive food habits. And as a result of that, a lot of extra body weight and metabolic disorders that come from that, right? That my dad died from morbid obesity and type 2 diabetes. And it was a terrible, terrible thing to watch. So I'm very familiar with this compulsive eating behavioral pattern. So if you recognize that and you think like, I feel like I'm addicted to food or to sugar, well, it's real, right? This is a very real thing. So rather than judge it, let's get really curious about it. Let's go, wow, that's fascinating. That's an interesting thing. What does it mean? Let's question it and not judge it or make it a part of the worthiness of who you are, right? Because cravings are just one side of the story. When we eat a lot of sugar or refined carbohydrates, our blood sugar spikes. That signals our pancreas to release insulin. And insulin, in turn, moves that blood sugar into our cells to try to bring things in our blood back into balance. But what became clear when I started looking at these genetic reports, that not only did 90% of these 20 reports, very small, little sampling there, have patterns of glucose and insulin dysregulation that was not working as smoothly as it should be, but their bodies really struggled to keep that in balance. And that's not important just because of diabetes, but cancer cells, including breast cancer cells, literally love to load up on insulin and insulin-like growth factor, IGF, right? IGF receptors make them more sensitive to insulin's growth-promoting signals, make these cancer cells more sensitive, right? So there was this study that was published in Breast Cancer Research and Treatment back in 1990, and it found that breast cancer tissue had over 6 times more insulin receptors compared to normal breast tissue. And those receptors were fully functional and active. So now we see the picture shifting a little. We hear a lot about sugar, right? Glucose. People are always talking about manage your blood sugar. But why? Not only can sugar have its own inflammatory effects and other things it does in the body, but the insulin piece of it, the insulin that it's always going to trigger when our glucose increases, is also a part of this equation that's really important. There was a study in Cell Reports in 2023 that found up to 80% of breast cancers overexpressed insulin receptors, and that the overexpression was linked to more aggressive disease and poorer outcomes. In that study, the authors said that breast cancer cells frequently overexpress insulin receptors, and this is associated with worsened prognosis. Then there was another in 2023, a study in gland surgery that compared tumor tissue to the normal tissue right next to it. And they found about almost 35% of the cancer tissue had high insulin receptor expression. And that was compared to only 15% of the normal tissue. And the higher the insulin receptor expression, the worse the patient outcome. So what does this mean for us in everyday, in real life? It means that when our insulin is chronically elevated, especially in someone who genetically may struggle to regulate their blood sugar, it doesn't just raise blood sugar concerns. The insulin itself can feed and fuel cancer. And that is an important thing to remember here. So sugar isn't just about a temporary energy crash. It isn't just about extra pounds. It isn't just about, will I have diabetes or not? It's about the health of your entire terrain and the internal environment where well-being or disease can take root. So the interesting thing here is that the brain and the body are in this together, right? So what is a craving? Why do I want to eat sugar? What is sugar doing? The brain can push you towards wanting that hit because it wants the dopamine. Dopamine feels good. And then the body struggles to manage that blood sugar spike that follows. So what can result from this cycle? Inflammation, fueling disease. And that can end up in the cycle that we experience of craving, spike, crash, craving again, right? We crave something, we have it, it makes us feel good for a little bit, we crash, then we get another craving because it doesn't feel good to be crashed, right? So it can become this really vicious cycle and it can feel super frustrating. So if you struggle with cravings, it isn't that something's wrong with you. It's not your worthiness. It's not that you need more willpower. Your brain and your body may literally be wired to make this harder for you. But that does not mean you're powerless. So this is where I want to circle back to where I started this episode with, that we can feel confused and we can feel overwhelmed because we don't know what works, what doesn't work, and no one can give us any promises of a cure when it comes to cancer. But we do have a lot of power. And why am I talking about sugar in this context? One, because of the things that I already showed you, that it can absolutely lend itself to supporting the increased risk of disease and poorer outcomes for disease, but because it's such a big part of our life. And because so many people struggle to give up or regulate something that can have a huge impact on their wellness. So this is, a lot of people look at naturopathic care, at complementary therapies, at metabolic health therapies. And I hear a lot about this is so expensive, or I can't afford that, or I can't afford this. There's a lot of things that cost absolutely no money, and in fact, probably can end up saving you money, that you can do to support the health of your terrain. A lot of free things. I mean, you hear about them on my podcast all the time, but this is absolutely one of them, right? Looking at the diet and cleaning it up, but not just, again, from a place of willpower, because willpower only lasts for so long. Willpower requires energy, and our cells in our body only have X amount of energy. We're constantly feeding and hydrating and trying to revitalize that energy, exercising, sleeping, doing the things that give us more energy. So when we've had a hard day, when we're stressed, when we don't feel well, when we're in pain, we don't have enough energy all the time necessarily to facilitate or turn to willpower. So we've got to look at things from a different way and have a strategy and a plan to support us instead of going into judgment and why do I do this and telling ourselves that we're powerless. If we can step into our power in some simple areas like this, and if we can understand that some of us, and I am definitely in that crowd, have genetics that are kind of working against us, then we have to figure out how to work with them. Okay. So you can start to shift the signals in your body by using some simple frameworks. So I mentioned the 5 S's. These are 5 powerful ways that you can start to calm your cravings, stabilize your blood sugar, and support your terrain. The first one, structure your meals. So every plate, we're really into snacking in the United States. We're just grabbing things. I remember when I worked in the corporate world, everywhere you walk down the hallway, there were these little like plant stands with candy bowls on top of them. You walk by people's desks. I mean, in the kitchen area, there was a break room where I worked, and that became like the dumping ground for everybody's leftover desserts. At holidays, people had parties and they'd bring the leftover cake and the candies and the cookies. I mean, just sugar everywhere. And so when we're not thinking about it and we're just, it's easily available and ready, we just grab handfuls as we walk by things sometimes, right? And we don't even realize how much we're taking in or why we're eating when we're not even hungry. So if we start to think about meals in such a way as the meals are what sustain us, meals are when we start to feel hungry and our body is saying, I need some more nourishment right now, right? But the snacking, this is just a habitual thing. I'm willing to stake a lot of money on the fact that most of us reach for a snack just out of habit, just because it looks good, just because it sounds good. And 99.9% of the time has absolutely nothing to do with hunger. So that's a dysregulated behavior pattern, right? So let's think about meals. The 5 S's. Structure your meals, number 1. Every plate, every time you eat, think about it in terms of having a well-balanced plate in front of you. Protein, fiber, and a healthy fat. Those together, every time you put something in your mouth, have those 3 together. So it slows down blood sugar spikes and crashes. So when we spike blood sugar, then we release a lot more insulin. But if our blood sugar is nice and even, then our insulin isn't going to go out of control. So let's say, for example, you want to have a piece of fruit. Well, fruit has a lot of sugar in it. So when you're having that fruit, maybe you cut it up, even berries. I have lots of clients, again, as you can see from what I just told you, there's a lot of my clients I work with are very sensitive to all kinds of sugar, and fructose in fruit is sugar. So they'll come to me and say, I don't understand. I had like a half a cup of berries and I was out of ketosis and my blood sugar went up, because their body is very sensitive to it. So maybe you can only have a quarter cup of berries. But when you have those berries, drizzle them with heavy cream, have them with a piece of cheese, have them with some nuts, right? Something that has more fat in it to help regulate, and so that anything that goes in your mouth is structured and always has a healthy fat and fiber along with it. Okay. Spotting hidden sugar is S number 2. You got to read the labels and you have to watch for sugar in disguise. Corn syrup, maltodextrin, cane juice, agave, honey. These are sugar, guys. I know people are like, well, they're natural and we think that all natural is good. Well, natural is sugar and sugar is sugar. And I had a client recently who was really upset, really frustrated. She's trying so hard. She has active cancer and it's metastatic at stage 4. And she is trying so hard and so committed to her program. But what she was doing was putting honey in a couple beverages throughout the day. And she could not understand why she was slipping out of the metabolic state she wanted to be in. And when we looked at how many carbohydrates were in that honey and how that sugar was affecting her, there was the key right there. It was a simple fix. So you may be like, oh man, I can't have honey. I'm not saying you can't have honey, but everything we eat, it has to be taken into context. What is the goal with the food? I've talked about this before. I have active Stage 4, metastatic cancer. My goal with food is to heal my body. So, do I have to be much more restrictive than maybe someone who does not have any active cancer in their body, has a healthy overall lifestyle, and they can have a little bit more sugar or honey in their tea here and there? Sure. So, we have to take things into context. This is not about restriction. This is about understanding the language of your body, what your body responds to, and what your goal is with the way you nourish yourself. So, our first two S's, structure your meals and spot hidden sugar. Our second one is stimulate healthy rewards. So, you've got to find new ways to light up your brain's feel good chemistry. Now, a lot of people that have, let's say you're thinking, well, how do I know if I have these SNPs? Well, I don't need to tell you. I don't need to say you have this and you have that and you have this. Tune into yourself and know your brain and know your body and listen and say, you know what, I do have a tendency to be impulsive, or I do have a tendency, like, for instance, I'll tell you, one of my weaknesses, I haven't had this in years, and God help me if I get around a bucket of it, but I love to go to the movies and I would love to have kettle corn drenched in butter. So you got the sweet and the salty and the fat. Oh my God. Oh my God. I can't stop myself. I would buy this bag of kettle corn and I would say to the kid, that's buttering the popcorn, I'm like, so can we make sure and layer the butter in? So, like, there's a ton of butter on this popcorn, right? We would get into the movie theaters and my husband could reach over and take, I don't know, 2, maybe 3 bites of the popcorn, right? He'd take a little handful and eat it, and then he'd be done. And I would be like, how are you doing that? If this bag is in front of me with buttery kettle corn, there's no stopping me, right? So I know this about myself. I know this about myself when it comes to white truffle potato chips, when it comes to Trader Joe's cookie butter. These are things I can never have in my house because I know me and I know how my brain works. I know that some people's brains can have a little bit of something and then they're very satisfied. And my brain cannot. My brain says, that's good. Give me more. So we've got to really know ourselves. And then we have to understand if our brain needs more feel good chemistry to satisfy it and calm the tendency to have urges and calm the tendency to have these impulsive behaviors, then we've got to be really intentional about inviting joy into our life. Because if we don't fill ourselves with intentional, healthy joy, intentional, feel good chemistry, we will have more cravings and we will probably try to resolve and buffer those cravings with food that probably isn't serving us. So, what does that look like? What do you love? Exercise, music, time in nature, laughter, connection with friends, reading a good book. What do you love? And how much do you do it? Painting, drawing, crafting, ceramic, anything, right? What do you really love that makes you feel so good and so happy? And then look at your life and say, am I inviting these things in? Am I really intentional about making sure that I'm seeing my friend at least once a month, right? Because time goes by fast. We get busy. Am I intentional about making time to see my kids or my family who live out of state? Like, where am I intentionally, and that means on purpose, bringing joy into my life? Where do I on purpose turn on music when I'm making dinner, right? Where am I bringing in joy? The more you can do that, the more that you can stimulate healthy rewards, the more you help to rewire your brain in a healthy way away from cravings that aren't going to serve you. All right. Stress less, sleep more. That's kind of 2 S's, but it's under 1 S category. So we've got structure your meals, spot hidden sugar, stimulate healthy rewards, stress less, sleep more. High stress and poor sleep will put your cravings through the roof. So you have genetics that predispose you and push you towards cravings, and you're under stress or you are not focused on good quality sleep, forget it. That's exactly what causes those kinds of SNPs, those kinds of genetic variants to express themselves. What does express themselves mean? Just like us, when I'm expressing myself, I'm talking out loud. The more I express myself, the louder I get, right? Same with our genes. So there are things that cause them to express themselves in ways we don't necessarily like. There are things that cause them to quiet down their expression. Lowering stress and improving sleep are two of those things. So intentionally, again, it comes back to intention, making sure you've got relaxation practices, commit to better sleep hygiene. I'm sorry to say, for those of you who love to fall asleep to the TV, that is not a good thing to do. So we think about quiet, silence, peace, winding down, cool environments, dark environments, good sleep hygiene, a routine and a consistent time before going to bed. When we can align our circadian rhythms, that our genes love that. They love it so much. It's like, oh, I'm taking good care of you. I'm doing exactly what you need so that this body can feel good. Our genes love that. And here is the biggest, right? The biggest. This is like the big bonus S, number 5. Stay consistent. Consistency is everything. Perfection, forget it, throw it out the window. No one is perfect. No one will ever be perfect. Things will happen. Things will come up. We'll skip meals. We'll get sick. We'll have parties. We'll have all the things. Life will happen, and let life happen. Life's amazing. Consistency means that you just keep showing up for yourself. Then we drop the judgment that if we went, oh my God, I binged on a box of Krispy Kremes yesterday, that was yesterday. Right? So stay consistent with how you support yourself and just get right back to it. So waiting too long in between meals, that you're so hungry that you make poor choices when you eat, those kinds of things, if they happen too often, that's where we kind of get out of balance. So really nourishing yourself regularly, intentionally. I keep going back to intention. Do this on purpose. Nourish yourself on purpose and show up for yourself consistently. A lot of times people say to me, I can never have this again. I can never have that again. And I'm just like, no, consistency. Again, context, right? Oh, now I'm coming up with some C's too, context and consistency. Because what's the context? What's your body going through right now? Does it need more support right now? Do we have to be more intentional right now? Are you being consistent? And how consistent? Is it 80% of the time you're consistent? Is it 90%? Is it 50%? Where are the opportunities here for you? All right. So let's review one more time. Structure your meals and think about meals. Like, let's say no to snacking. Let's really consciously, when we reach for a snack, say, am I hungry? If not, why would I be putting food in my body? Think about that. Spot hidden sugar. Really be aware. Sugar is in everything. It's insane. Stimulate healthy rewards. Intentionally invite joy into your life every single day. Stress less, sleep more, stay consistent. These are 5 powerful things you can do, and they don't cost a penny. In fact, if you can stop snacking and you can cut out sugar and you can really be intentional about when you're hungry, you probably save money because you'll be buying a lot less food. Years ago, I remember marveling when my husband and I both started doing fasting and intermittent fasting and a little more extended fasting, and really changed everything up and followed, a very low carbohydrate diet, and became very intentional about, my whole food plan to support my healing. We cut our grocery budget in half. And that was shocking to me because I already thought I had a great diet, a great nutrition plan. But when I really stopped and looked at what my body needed and what served me, not only did I save money, I lost 75 pounds. Okay. So these things don't cost anything. These are powerful things you can do to support yourself, and they're completely free. Does that make them easy? Not all the time, but they are powerful and they'll work for you at no cost. All right. So you think about the 5 S's. Think about that as a roadmap for calming cravings, for creating a nice, stable, calm internal environment that supports your healing. Right. So remind yourself again, when you the language we even use, like, I can't stop eating sugar, or sugar is calling to me. Think about the language and even say to yourself, well, that's interesting that I decided to use those phrases with myself. What if I just, instead of saying, I can't stop eating sugar, I went, wow, it's interesting how often I'm compelled to eat sugar. That's fascinating. What if we just start moving out the judgmental, because I can't stop eating sugar? That's kind of a self-judgment, right? It's very limiting. It's saying you have no power, like a substance has power over you, right? So we think about the context in which we talk to ourselves. And can we change that? Can we use more supportive language? Because even that brings more joy and less stress, right? Beating ourselves up and being judgmental, that's stressful. So your genes in your brain and in your whole systemic regulation patterns, they may influence you. They may have a pull on you, but you are the captain of the ship, and you can make choices that will calm those cravings. All right. So follow the 5 S's, start to change the signals of your body and create more stability and a healthier terrain. And I want to say to you, go to my website, thebreastcancerrecoverycoach.com, and get my 5-day sugar challenge program. This is not a stop eating sugar for 5 days. This is a let's really look at your brain and understand the way your brain is driving you. It's completely downloadable. You have it for life. You can do it over and over. It's simple, but it's a loving, heart-centered approach and a curious approach to why we make the choices we make, and to increase our awareness about those choices and to make conscious and intentional decisions about how to switch them, even if our body is kind of wired to work against us, right? So we're going to rewire the body. All right. So there's a link to that in the show notes for this episode. You can go straight and check out the sugar challenge, or just go to my website, thebreastcancerrecoverycoach.com, where you can see all of the different programs. And of course, my Better Than Before Breast Cancer Metabolic Health and Mindset membership, where together we explore all mind, body, energy, everything that you need to love yourself, build your self-compassion muscle, understand how to nourish yourself, and support creating a life that is better than it was before a breast cancer diagnosis, and knowing that you have all the power to do it. All right, get all that information on my website, and come and find me on Facebook and Instagram, Laura Lummer, the Breast Cancer Recovery Coach. Let me know what you think. Let me know what challenges you. I'd love to hear. All right, friends, I'll talk to you again next week.